Welcome, everyone. My name is Krista Natoli. I'm the Executive Director for the Center for Telehealth and eHealth Law. For those unfamiliar with CTEL, we are a 501c3 nonprofit research institute based in Washington, D.C. We cover all areas of legal, regulatory, and policy issues impacting the delivery of digital healthcare. We are so honored to have with us today a staffer from Congresswoman Doris Matsui's office, Democrat from California, who is going to be the first of our inaugural series talking about hearing from the Hill. So please welcome Jackie Weinrich with us today. Jackie, say hello to everyone. Jackie
Hi, thanks, Krista. Sorry.
Yes, of course. No, Jackie is a legislative assistant with Congresswoman Doris Matsui's office, and she is here today to talk to us about a new bill that was introduced by Doris Matsui and the outgoing Bill Johnson, Republican from Ohio. The bill is known as the Behavioral Health Information Technology Coordination Act, also known as BHIT. The legislation will improve coordination of mental and physical health care by supporting behavioral health providers' efforts to adapt to health information technology systems. We are here to hear all of the intelligence and all of the behind the scenes workings of this bill and what your boss aims to do if this legislation is passed. Jackie, take it away.
Yeah, absolutely. Well, thank you for having me. I did not realize this was the inaugural of a series, so thanks for letting me break the ice here and go first. I'm going to share screen. I have some slides, if that's okay. Oh, wait, it says host disabled participant screen sharing.
Should work right now.
Okay, let me try again. Sorry, folks. Okay, share. You can see that?
Yes.
Okay, perfect. And I'll put it as a slideshow. Perfect. So as Krista mentioned, I'm going to speak about the Behavioral Health IT Coordination Act. Also just kind of give a general update given there's been some exciting developments in the behavioral health IT space of late. And my boss, Congresswoman Matsui, has been a champion on this issue for a long time. So appreciate you having me to share about these issues. So I'm just going to give a brief landscape. I know some of you all may be familiar with this already, so bear with me. But there's evidence across settings that behavioral health health IT uptake specifically of certified electronic health records lags behind in behavioral health settings compared to your more traditional physical health settings, so primary care, acute care hospitals, et cetera, et cetera. MacPac reports that only about half of psychiatric hospitals are using electronic health records compared to almost all general med-surg hospitals. And then office-based settings, we're seeing similar trends, mental health lagging behind. Your community psychiatrists, less than 2/3 of those have an electronic health record compared to almost 90% of family medicine, almost 100% of specialties like cardio. So they're really lagging behind. Why is that? Number one reason is cost. Health Affairs has estimated somewhere in the neighborhood of around $50,000 for an investment of to adopt an electronic health record and that's for a typical primary care practice. And then of course, as you increase in complexity and provider count in those clinics, the cost increases. So for our smaller behavioral health clinics or community mental health centers, those costs are just too high. And the reason they're not too high for your typical primary care or specialty care setting is because Congress passed the HITECH Act several years ago, infusing $27 billion to providers for electronic health record uptake. But as we know, that bill left out any incentives for behavioral health providers. So most behavioral health providers were not included in that incentive structure. So there's a lack of a similar incentive for behavioral health providers to pay those upfront costs, invest in electronic health records. And then finally, I think this is an interesting point, kind of a symptom and a cause of the lack of uptake. The tools that are on the market now in electronic health records space are not necessarily geared towards behavioral health providers. There are specific considerations, right? Privacy, 42 CFR, other specific things that are necessary in a behavioral health setting that perhaps the EHRs that are out there are not meeting. And that's because there's not a market for those developers to invest in creating those softwares. So I think kind of an interesting cyclical point there. And of course, as we know, this has a major impact on our ability to create a behavioral health system that is really person-centered, helping folks get access to the physical health care, the mental health care, and the social supports that they need, which is the direction we're trying to move the behavioral health system in, but not having the data and the ability to have those providers talk to each other really impedes our ability to make progress there. And so this has led to several organizations making recommendations that Congress act in this space to basically provide incentives to help behavioral health providers take up these technological tools. MACPAC has included this in their recommendations to Congress. Bipartisan Policy Center, the United States of Care, the National Association of Medicaid Directors has asked for this kind of resource. And then not to mention, HHS has included health IT uptake in their behavioral health integration roadmap, which came out several years ago. So a lot of consensus around this being really important to move forward. So given that, my boss introduced HR 3331. This was back in the 115th Congress with then Congresswoman Lynn Jenkins of Kansas. And this bill essentially authorized CMMI to create a demonstration model testing whether incentive payments for behavioral health providers would increase uptake and then would therefore reduce costs, improve care coordination, et cetera, et cetera. And this bill was wrapped into the Support Act of 2018. This became Section 6001 of the Support Act. So we're very excited about that. However, what we saw was that we can give CMMI the option to create different models, but they really march to the beat of their own drum. We can't actually really require them to do too much. So despite passing in the Support Act in 2018, 5 years came and went with no action from CMMI really in this space. So given that, the Congresswoman has made repeated attempts to push them forward on this bill. Last Congress, we introduced with then Congressman Mullen, who's now Senator Mullen, the Behavioral Health IT Now Act. So that would have unlocked funding at CMMI to allow them to put forth that model, essentially. That bill stalled in committee. And based on some community feedback, we decided to go a different direction this Congress with our legislation, which I'll talk about in a bit. But the Congresswoman still has been pushing CMMI to come forth with a model that includes this kind of incentive payment. And so she and Congressman Bill Johnson led a letter back in October to CMMI, pushing them for more information on when are they going to implement this model, what kind of progress have they made, and essentially asking them to create such a model as soon as possible. And so to their credit, they sent us a nice response. They cited several models in which they already had included small behavioral health IT incentive payments. So their maternal opioid use misuse model, and then the integrated care for kids model actually both included minor incentive payments, but of course those are very targeted, and we wanted to see kind of a larger a scope. But they committed to continuing to work to implement Section 6001 in their response to this letter, and very exciting to see what they actually followed up on that response. A couple of weeks ago, they announced their integrated behavioral health model, the IBH model. So we were thrilled to see this. The overall goal of this model, as I'm sure folks have seen so far, is to improve overall quality of care and outcomes for adults with mental health and substance use disorder needs by connecting them again with those physical, behavioral, and social supports that they need to have that whole person care. And as we all know, as we've touched on, health IT is a huge component of making sure that those systems can talk to each other and we're actually able to achieve those goals and provide those outcomes for adults with mental health and substance use disorder needs. So one of the key pillars of the model is that it will promote health IT capacity building. So we're very excited to see those incentives included. The initial eligibility for this model will be 8 states. CMMI's letting us know that they will be opening applications in spring, and hopefully funding will be going live by the fall of this year. And then within those states, the practice participants are going to be those community-based behavioral health providers. So like our CCBHCs and any kind of social safety net providers for mental health. And then specific requirements as it pertains to health IT. Sorry if you can hear the bells in the background. There will be initial upfront funding for health IT tools, specifically electronic health records, but then also, interestingly, they included some other kind of virtual health tools, payments in there as well, so including telehealth. And that will be required components of the model. So Medicare and Medicaid are including payments for those. And then all practice participants will be required to adopt and use health IT standards, which are currently under development at ONC, from what I have heard. And so briefly, I wanted to mention, circling back to that point about tools, I think with ONC working on standards, with the infusion of cash into behavioral health providers, being able to take up these tools, I think it pushes us towards having more of these tools available and having developers really pay attention to what behavioral health providers need, and hopefully creates a snowball effect of having more of those specialized systems available for behavioral health providers who might want to invest in this separately. So while we were very excited, of course, to see the model come out, and it's a huge step in the right direction, of course, it is only a first step, and it's only 8 states. So we continue to push on the Congresswoman's Behavioral Health BHIT Coordination Act, which is another way that we would provide funding for behavioral health providers to uptake these tools. And that was introduced this Congress, this new legislation. It's Representatives Matsui and Bill Johnson over here, and then Senators Mullen and Cortez Masto on the Senate side. And the key pillar here is authorizing this $20 million a year grant program that would be through ONC, providing grants to behavioral health providers to facilitate uptake of certified electronic health records technology, which is really a drop in the bucket when you consider how much investment we need to really get every behavioral health provider up to speed. But we hope, again, that it's a step in the right direction, and coupled with CMMI's initiatives, right, I think it gets us closer to being in the right place. There's also these other pillars, provisions, including requiring ONC to develop, again, voluntary behavioral health IT standards, so getting those tools in the right spot, and then directing CMS, SAMHSA, and ONC to work together to identify other opportunities for Medicaid to support these activities as well. And so state of play on that bill, unfortunately, we were not able to include the entire text of that bill in the Support Act, which we are working on reauthorizing currently, both in the House and the Senate. Some of you may be familiar, the environment currently is very toxic to new authorizations and new programs. So just given that it was an additional grant program without necessarily a pay for, it was really difficult for us to get that included, despite, again, bipartisan consensus that this is good policy and we need to advance these tools, et cetera. However, the Senate leads were able to negotiate on this roundtable language that was included in the Senate passed Support Act. And so what this would do is essentially ask ONC to pull together a roundtable. Participants would include public and private stakeholders, hopefully representation from health information exchanges, payers, providers, patients, the whole gamut of folks who are invested in this area. And they would be asked to come up with recommendations, as well as kind of an assessment of all the factors regarding behavioral health IT uptake, specific considerations for health IT in the behavioral health setting, what the costs might be, what the benefits might be for care integration, et cetera, et cetera. So really just bringing together a conversation and a report to Congress on kind of why these tools are needed. And our hope is that would give us additional leverage to move forward for additional resources in the future if we have this stamp of approval from ONC. I'm not entirely sure. I mean, I can't predict, whether or not this language will make it through in the final negotiated support act. But we continue to make the push, even given that CMMI has moved forward. We think all the buy-in we can get from the government in terms of behavioral health IT is super important. So that's all I have for you in terms of presentation. I'm happy to answer any questions anyone might have, or kind of open a larger discussion about behavioral health IT, whatever's helpful at this point, but I will stop sharing for now.
Thank you, Jackie. We really appreciated such a wonderful presentation. And we're really glad that you kicked off our inaugural series of Hearing from the Hill. Do we have any questions right now for Jackie? You could turn your microphones on and ask directly, or you could just put it in the chat. So one of the questions, Jackie, is if one of our members wants to be able to support this effort on an individual level or a health system level, what's the best way to do that?
Yeah, absolutely. I mean, I think there are so many different ways to engage right now. I see a question from Joe in the chat too. I'll just answer really quick. So this is one of the ways you can engage right now. The 8 states have not been named yet. And I think the first step, CMS is planning to announce a notice of funding opportunity sometime in the spring. And then states will be able to apply for those questions, or sorry, for those for that model. So if you want to engage with your state to, if you're located in a state, or if like a state that would be a good fit, that's like a first step to helping them adopt this model. In addition, if we are able to pass this roundtable language, I think one of the ways that's really important to engage would be engaging with ONC, being included in that roundtable, having your voice heard in those discussions. Again, I think kind of bringing together a public-private really strong recommendation that this technology is needed is helpful for us as we try to get more funding and more resources for this conversation. And then I think the last thing is, of course, we're always looking for support for our Behavioral Health IT Coordination Act. So if folks want to set up meetings with members who maybe if you have a relationship, or if your company is based in a certain state, that having more co-sponsors of our bill helps to move that forward too. So there's kind of 3 different steps there.
Have you been in direct contact with ONC?
They have provided TA on our legislation. We haven't, necessarily had like an open conversation about this, but I think they had a roundtable focusing on behavioral health IT. I'm gonna have to look up specifics on this, but I want to say like 10 years ago. So I think they have been at the forefront of this conversation as well, and know that these tools are really necessary. They just have not necessarily had the resources to put that forward.
Any insight on the reauthorization?
Sorry, of Support Act, or
Yes.
which reauthorization?
Sorry.
Yeah, I think anyone's guess is as good as mine at this point. But the Senate has now passed something, the House has passed something. I think that conversations are going on between committee leadership and leadership overall. There's a lot of conversations about what kind of vehicles, what kind of packages Congress will be able to achieve. And I do think there's a lot of interest and pressure to reauthorize this entire package soon, given that authorities expired in October. I see some questions in the chat too. Some folks are interested in what's getting in the way of supporting legislation. What are the main objections of the critics? I really do believe it's mostly cost. And I think, yeah, again, we're just in an environment right now where getting additional funding and authorizations for new programs is very tricky unless you have a specific thing you can point to where you're going to offset the cost, and that that carries its own challenge as well. I mean, if we're looking at support, it's like, okay, are we going to cut funding from this mental health program? You know, it's tricky political situation there. And so we just weren't able to find the pay for. That being said, I do think, I think CMMI kind of starting the conversation on this and starting providing some resources, perhaps gives us a little bit more leverage in terms of our bill. Not that it necessarily reduces the cost, because the grant program is going to be the grant program either way, but I think starting to have kind of funding rolling out here and just adding to the momentum is a little bit different than creating something completely brand new with the government.
Mm-hmm. I want to be mindful of your time, because I know that the goal of these meetings are to be little micro sessions that we could hear from you and get little bits of intelligence from the Hill. Do we have any other questions from our membership? Okay. Well, Jackie, thank you so very much for taking the time with us today. What a wonderful meeting. And thank you for the information. We will talk.
Yeah, of course. Thank you for having me again. This was wonderful to be able to speak to you all, and feel free to email me and if you have any additional questions or want to chat. I can put my email in the larger chat.
Wonderful. And hopefully we'll see you at June at the CTEL Summit. Take care, guys. Bye.